Hello, my name is Rosanna Brunhard, and my community resources was based on the Palm Beach Treasure Coast Area Agency on Aging. The Area Agency on Aging of the Palm Beach Treasure Coast, also called Aging and Disability Resource Center, is a nonprofit organization established to serve seniors 60 and older, adults with disabilities, and their caretakers. The agency administers the Older Americans Act, which provides services, information access, resources, and assistance funded via general revenue, grants, and donations. The interviewees consisted of Ms. Nancy Yarnell. She is the Director, Planning and Consumer Care employee of the Area Agency on Aging of the Palm Beach Treasure Coast. Along with Ms. Kim Clausen, she serves as the Director of the Helpline. It is located at 4400 North Congress Avenue in West Palm Beach, Florida. They also have offices on the Treasure Coast in St. Lucie County and in Martin County, located in Stuart, Florida. The Area Agency on Aging of the Palm Beach Treasure Coast is also called the Planning and Service Area, the PSA 9. It's viewed as a network serving Palm Beach, Martin, St. Lucie, Okeechobee, and Indian River County. 4 of the 5 counties are located in the eastern side of Florida on the coast near the Atlantic Ocean. Okeechobee County is located west of St. Lucie County and is the only inland county of the 5 counties. The PSA 9 territory covers 550,000 individuals aged 60 and over that reside within the 5 counties. This is indeed the largest area agency on aging in the entire state of Florida, measured by its elderly residents. $7,288 clients are served monthly. Only 1.31% of the senior population in the PSA 9 area actually receive services. Over 2,400 clients receive congregate meals. Over 1,000 clients received home-delivered meals. 6 clients received other services. 391 clients received transportation services. Over 300 clients received adult daycare services. Over 100 clients received basic subsidies. Over 1,300 clients received case aid management. Over 200 clients received counseling training support, and over 1,400 clients received in-home equipment supply service. I designed this graph to illustrate that the largest number of services received is the congregate meals. 5,123 clients received services amongst the 5 counties, excluding Medicaid Long-Term Care Program and PACE, which is the Program of All-Inclusive Care. Over 3,500 clients were served in Palm Beach. Over 500 clients were served in St. Lucie County. Over 400 clients were served in Martin County. Over 341 clients were served in Indian River County, and over 242 clients were served in Okeechobee. And clearly, Palm Beach County served more clients than the other counties. Here is a graph that I designed to illustrate that Palm Beach County is serving more clients than any of the other counties in the 5 counties. Palm Beach County is also the largest of the 5 counties. Over 6,316 clients are waiting for services. This excludes Medicaid long-term care and the Program of All-Inclusive Care. Over 24,208 clients are waiting potentially for services. This number does include the Medicaid long-term care program and the program of all-inclusive care PACE recipients. Over 16,000 clients are waiting for in-home services, over 1,300 clients are waiting for home-delivered meals, over 1,900 clients are waiting for other services, over 1,400 clients are waiting for adult daycare, and over 500 clients are waiting for basic subsidies. Over 2,800 clients are waiting for case aid management, and 4 clients are waiting for training, equipment, services, and counseling. The number of staff at this agency is extensive at 64 employees. The CEO is named Jamie Stramara Fitzgerald, and I attached a photo of him. They have a director of communications. There's also an executive assistant. They have a compliance director of organizational integrity. They have a consumer care and planning unit. Ms. Yarnell, again, it was the interviewee. She's the director in planning of consumer care. They have consumer service employees. They have consumer service consultants. They have customer care receptionists. They have elder care, elder rights project directors. They have an elder crime intervention coordinator. They have in finance. They have a director of fiscal administration, a fiscal specialist. They have a chief financial officer and accountants. In the foster grandparent program, they have a project director and foster grandparents. They have volunteer coordinators and volunteers. They have a healthy living director and coordinator for Medicaid specialist, Shine. They have a customer care specialist. They have a waitlist manager. They have an intake supervisor and specialist. They have a helpline information. They have a director for manager and specialist and referral specialist. Kim Clausen, again, who was an interviewee, is the director of the helpline. They have a human resources department director. They have an information technology department director. They have a software developer. They have a Shine projects director. They have a benefits outreach coordinator. There's quite an extensive staff. How often is the agency mandated to see clients? According to Ms. Yarnell, the contact requirements do vary by the program. Typically, mandated to see clients and review care plans semi-annually and annually. The intake process commences when a client makes contact with the elder helpline or another access point that's contract service provider. Forms are gathered that gather information so potential clients are screened, categorized, and prioritized. A score and rank is then created. Based on the greatest need, will receive the services first. Appointments are made not later than 14 business days from the initial contact. Applicants that can't be served immediately are on an assessed priority consumer list. Typically, consumers both receiving services and the ones that are on the priority wait list that are deemed eligible will be assessed, rescreened, and reassessed annually. Once a client is determined to be eligible for services post-comprehensive assessment, a care plan is created. The case manager coordinates services offered by the agency in the community care service system and organizes informal sources. Services not arranged via the agency contracts can be made with referrals using community resources. Referrals may be made to volunteer agencies, informal networks, and proprietary agencies that charge fees. Managers or aides conduct a post-contact on service arrangements and referrals within 2 weeks to determine whether services have commenced. The high-risk clients, in order to prevent harm, are given priority and receive case management and crisis resolution services within 3 days of adult protective services referral. Typically, the home visit and review the care plan at least every 6 months or more, depending on the evaluation concerning the individual's needs and the program criteria requirements. Typically, a one-on-one face-to-face client reassessment is made once every year. The subcontracts with other agencies delivering services, a service secure network, has over 1,500 contracted providers. They consist of the Alzheimer's Community Care, there's a Council on Aging of the Martin County, a Council on Aging of St. Lucie County, Critical Signal Technologies, Palm Beach County Division of Senior Services, the Federation Transportation Services, the Florida Rural Legal Services Legal Aid, the Society of the Palm Beach County, MD Home Health, the Morris Life Care Management and Counseling, the Okeechobee Senior Services, the Palm Tram Palm Beach County, the Ruth and Norman Ray's Jewish Family Services, the Senior Resource Association, the Volin Center. The population served and services provided, information and referral services. The center has a toll-free helpline that provides information on services. A comprehensive assessment determines eligible clients. A case manager coordinates services offered by agencies in the community care system, organizes informal sources. Services not arranged through agency contracts can be obtained through referrals with other community resources. Referrals may be made to volunteer agencies, informal networks, and proprietary agencies that charge fees. Income programs. There's a health insurance needs of elders called SHINE. It provides free health insurance information to Medicare and Medicaid beneficiaries, disabled adults, and their caretakers. Information consists of educational seminars, presentations, and senior health resources. This program is administered by the Centers for Medicare and Medicaid, the Department of Elder Affairs, combined with the Aging and Disability Resource Center. There is an emergency home energy assistant for the elderly program. This is covering households containing at least one member over 60 years of age with financial challenges who meet income guidelines. They may qualify for financial assistance in paying their energy bills. This is coordinated with the Department of Elder Affairs and the Aging and Disability Resource Center. Benefits Enrollment Center is another income-based program. They provide free assistance for low-income Medicare-eligible seniors and persons with disabilities. There's help with food stamps, Medicaid, low-income home assistance program, and Medicare Part D extra help for low-income subsidy program. There's a home care for the elderly, HCE. This provides care for persons 60 and older in family-type living arrangements within private homes as an alternative to institutional nursing home care. A basic subsidy, which averages only about $106 a month, is provided for support and maintenance of the elder and includes some medical costs. Special subsidy may also be provided in addition for services under supplies. Eligibility is based on 60 years and older and having a living caregiver or caretaker, and you have to meet financial income and asset criteria. There's a Senior Community State Employment Program administered by the U.S. Department of Labor. It serves low-income persons 55 and older. Individuals are placed in part-time community service positions with the goal of transitioning them to unsubsidized employment. The state plan aims at fostering both short-term and long-term coordination among various organizations and key stakeholders. There's a nutrition meals program with home delivered meals. The area and agency combined with the United Way and Meals on Wheels delivers meals to seniors residing in home environments. The Division of Senior Services provides senior nutritional congregate meals at many senior centers and home delivery. The Volent Center, a contracted partner, provides free seniors meals and transportation. The Healthy Living Center of Excellence is a program that offers workshops on improving nutrition and exercise options. Seniors learn about the community resources in their area. They also sponsor a diabetes self-management program developing healthier diets as a preventative measure. The Legal Services. There's a Legal Aid Society of Palm Beach. It serves the Palm Beach County residents, provides representations to individuals 60 years or older. It also represents victims of abuse and exploitation by relatives, merchants, or others. It helps to handle Social Security, Medicare, and housing matters, and provides special assistance to grandparents raising grandchildren. There's also the Florida Rural Legal Services. It serves the other remaining counties. It handles area legal issues involving health care, nursing home placement, Medicaid, and end-of-life planning issues such as a will, a power of attorney, and a healthcare surrogate. Any other services the agency provides? There's an adult daycare centers. There's community care for the elderly program providing community-based services for functionally impaired persons 60 years of age or older. There's an Alzheimer's disease initiative program that provides a community-based service for the special needs of individuals aged 18 plus with Alzheimer's disease and related memory disorders. And caregivers are also eligible. There's also an Advocacy, Aging, and Disability Resource Center Foster Grandparent Program. This entails senior volunteers that mentor and tutor children with special needs. There's an Elmore program that helps seniors with reverse mortgages to receive financial assistance to prevent foreclosures. The Lumen Group, contracted to assist the Aging and Disability Resource Center, to become ready to contract with local veteran medical centers to offer the veterans direct home and community-based services. Any unmet needs or challenges faced by the agency? It's a very large territory between Palm Beach County and Indian River County, covering the 5 counties combined. This creates a very significant travel challenge to spread out the limited resources over such a large population. Only 1.3% of the elderly residents that are in that 5-county area are being served by the agency based on the limited resources. The helpline actually averages over 6,000 calls monthly, but there's a lack of adequate administrative dollars for some main programs. The agency has oversight and waitlist responsibilities, creating challenges. They can't expand current programs that do meet the needs of the seniors, caregivers, and individuals with disabilities based on a shortage of money. Funding allocations do not keep pace with changing population demographics. Approximately 100,000 persons 60 years or older are moving to Florida each year. There's a shortage of volunteers, lack of money that will support management and training of these volunteers for many of the agency's programs. There's a lack of a wellness and disease prevention program for homebound individuals. Transportation access and lack of low-cost, accessible housing for seniors and persons with disabilities. There's an unhealthy eating habits since seniors can't access healthier food choices or are expensive for their fixed income budgets. Seniors are also targets of elder abuse and illegal fraud perpetrators, and law enforcement is stretched to keep up with economic crimes. Concern is coordinated also with disaster response plans with the state and county emergency operations centers. How the agency compares with the aim of the Older Americans Act. as described in our textbook? Well, the PSA 9 territory stretches from Palm Beach, Martin, St. Lucie into River, Okeechobee County. It's only providing 1.3% of the senior population in that community is only being served based on what was intended of the Older Population Americans Act. Clearly, this is a low service ratio. Many seniors are on waiting lists. The helpline receives over 6,000 calls monthly. With funding limitations, there is only so many slices in the pie, and it can't go around for everyone. Older Americans Act, with the 10 objectives, are nearly impossible to implement for the staggering, condensed older population. Resources most helpful to a professional geriatric care manager. Obviously, the main resource that every potential professional geriatric care manager would want is money, funding resources, whether it's government or private funding in terms of grants or donations for the continued success of the agency's mission. Another resource that would be helpful was capable and kind employees and volunteers that are also trained. We certainly need qualified, well-trained staff, employees that have credibility. Employees should be patient, kind, compassionate, caring, since they will be interacting with the very vulnerable segment of society, our older age population, and they certainly need to be compassionate. Perceptions on the interview experience and any insight you might have gained from it, or I might have gained from it. The PSA 9 agency is a high-level, sophisticated, well-coordinated service and assistant provider for its clients in its designated area in Florida on the southeast coast up to the Treasure Coast. Ms. Yarnell is a dedicated professional determined to meet the needs and challenges of the elders in her PSA territory. Despite the monetary shortfalls, she maintains a positive energy and appears accomplished in helping her clients. Ms. Clausen, in charge of the helpline, has a very challenging task with over 6,000 potential client calls monthly. Based on limited resources, obviously can't help everyone to the fullest extent possible. However, she maintains a professional demeanor in her daily challenges and approach to the agency's problem.